and welcome to our special show. I'm Gargi Rawat. COVID has shaken up the world in more ways than one. While COVID has given rise to new challenges and uncertainties, the pandemic has also yielded some valuable lessons. What we eat, our exercise habits, general hand washing, hygiene awareness have garnered greater focus. While dealing with COVID, we overlooked the fact that people's lifestyles were severely disrupted. And as a result, metabolic problems have become more common. Unhealthy eating habits, lack of physical activity, and the mental toll of quarantine, isolation, and even fear of contracting the virus in healthcare settings all have adversely impacted people with diabetes and heart disease. A multi-sectoral approach promoting healthier diets and increasing physical activity can help in slowing down diabetic epidemic and heart diseases. Today we have experts with us to share with you advice for leading a healthy life. We have Dr. Pradnya Kamble, diabetologist, Nirmata Healthcare, Hyderabad; Dr. Parimal Swami, consultant physician, Jabalpur Hospital and Research Center, diabetologist, Apollo Center for Diabetes and Asthma Care, Jabalpur; and Dr. Rajeev Bagarhatta, senior professor, Department of Cardiology, SMS Medical College and Hospital, Jaipur. Thank you so much, doctors, for joining us on the program today. And Dr. Kamble, I'd like to start with you. COVID seems to affect people with diabetes more adversely than others. They may show more long-term effects than others as well. And what extra precautions should people with diabetes take post-COVID recovery?
The post-COVID situation with the diabetes people. If you have seen all the studies, or if you have read all the studies, or most of the studies, they say that a diabetic person or a diabetic people, they have all the complications double rated to combining to or discussing to it, looking into the normal people. If you take heart attacks, they have been doubled. If you take strokes, they have been doubled. If you see the kidney situations, they have been doubled. So during this COVID situation, what happens is there are some drugs which are life-saving drugs being used to treat the COVID situation. So in this situation, there may be increase or there will be increase in your plasma glucose level. So maintaining this glucose level post-COVID situation, you have to follow your doctor's advice and take the medication as it is required. Sometimes you may need injectables or oral tablets. Along with that, during this pandemic situation, they said don't go out, yes, but you have to modify your exercise, do yogas, in-house exercises, so that wherein you maintain your plasma glucose level. The main situation is maintain your exercise, take the proper medications what your doctors prescribe on time as required, whether it is injectables or oral tablets, with your lifestyle modification, that's your diet pattern, which gives you a good plasma glucose control, wherein your recovery will be very fast.
All right. Thank you so much, Doctor. Now, Dr. Swami, doctors recommend changes or modifications to one's diet to help manage chronic health conditions. What type of diet would you suggest for people with diabetes post their recovery from COVID?
I always say that diet is one of the most important interventions for the management of diabetes and for the prevention of the target organ damage. There are a few principles behind the diet which should be prescribed to a diabetic person, not only a post-COVID diabetic but all the diabetics. The principles are that a person should eat around 4 meals a day, 2 small meals and 2 major meals, should eat a very healthy, low carbohydrate breakfast, should include salads or some raw vegetables in each of the meals, should control the amount of the carbohydrate and grains, increase the amount of the protein. For vegetarian, this should come from the pulses, from paneer or from some dairy item. For non-vegetarian people like who eat non-vegetarian food, it can come from the healthy non-vegetarian alternatives like chicken, fish or egg white. Fruit in moderation, alcohol in moderation. A person should include the healthy fats in the diet, some amount of the nuts, and they should rotate the cooking oil to get the benefits of all types of cooking oil which are available in our country. And we should also include some supplement if required, if the condition warrants it. So this is in short about the diet. So people who are suffering from renal problem or hepatic problem, in those people the diet should be modified according to their background illness. So this is in short about the diet, and I think this diet will go a long way in prevention of the infection and all the target organ damage, not only for the post-COVID patient but for all the diabetics.
Dr. Bagarhatta, post-COVID, post the recovery from COVID, otherwise healthy people are now experiencing an increase in blood pressure. Now, is this normal? Will this elevated blood pressure come back to normal?
Yeah, I mean, there are two points with regard to this question. Those patients who have had a very torrid course during the hospital stay, it has been seen that more often than not, they had been having some latent hypertension or high blood pressure. It's just that during the course of COVID illness, their high blood pressure was manifest. So it is these group of patients who have had a very torrid course or a very turbulent course in the hospital, whose high blood pressure is going to stay, and they will require high blood pressure medications for a long time to come. Some other patients who came out unscathed from the COVID illness, in those cases, high blood pressure may persist after they have recovered from COVID, and the reasons are different here. That is, in some cases of COVID treatment, they have been prescribed some medications. For example, most of the people, or many patients have been prescribed. In other group of patients, there has been a myth that a couple of drugs which are being used for treating high blood pressure are supposed to be withdrawn during the COVID illness. An important group of medication is the group of given that is ACE inhibitors. So there are 2 points to it. One is those patients who have been given extra drugs for their COVID treatment like steroids, and the other group of patients who have withdrawn their antihypertensive medication during their COVID treatment. So in these cases, it's likely that these patients may recover from their high blood pressure after their COVID recovery.
Dr. Swami, when you get diagnosed with diabetes, several restrictions come in. Can people with diabetes actively participate in outdoor activities?
Yes, just for the information, the cardiorespiratory fitness, that is your ability to undertake exercise, is one of the most important factor for your long-term health. And no intervention would improve your cardiorespiratory fitness except exercise. So exercise is important, but with a caveat. In people who are suffering from diabetes, they should check 3 organs before they are undertaking exercise. They require a full medical checkup to rule out the presence of retinopathy, that is the involvement of the eyes because of the diabetes, the cardiovascular status or the condition of the heart, and third, the condition of the nerves in the lower limb, because if the nerves are affected, then that person may become imbalanced while undertaking the exercise. If these are normal, even the people who are suffering from cardiovascular disorder, who are having weak heart, can also derive benefit with mild exercise. Generally speaking, a person should undertake exercise, like he can go outside for jogging, walking, running, bicycling, or even swimming. And before that, he will need an exercise stress test so that a doctor and the patient both will know the amount of the exercise that a person can undertake. 3 or 4 days a week aerobic exercise, twice a week weightlifting exercise, twice or thrice a week stretching exercise or yoga. This is the whole exercise prescription for the diabetic patient.
Dr. Kamble, the foods you eat can have a major impact on diabetes and blood sugar levels. Is it true that people with diabetes should only eat diabetic food?
When a person detected as diabetes, the first thing which moves or reels in his mind is that I have to leave all my food that I can't eat. The thing is that you can eat anything. Only thing what you have to leave is the food which is more in glycemic index. That is example like sweeteners, that is like your products of sugarcane. Some products of like coconut, and these things where the glycemic index is more, you have to stop those things. And we have to reduce some food which is high in glycemic index, but it is required to survive, like rice. You have to, which is more in high glycemic index of carbohydrates, what they say. But we have to reduce in that quantity and maintain it so that your glucose levels will be always in. Now, in a standard time, what you require your fasting glucose to be around 100 and postprandial to be around 130 to 140. So, the diet pattern what we give is or what I prefer to give is this pattern what the patient eats in his house, modify the diet from his own food, which he finds it very easy to modify himself, rather than giving our own diet for him, where it will be difficult for him to monitor it. It is simple and easier for any diabetic patient to keep up with a high glycemic index food, and they can take any other food which is required with them, keeping in mind the time and quantity of the food has to be maintained regularly.
All right, well, thank you for that, Dr. Kamble. And time for us to slip into a short break now. You're watching Beat Diabetes, Myths versus Facts. We'll be back with more after this short break. Welcome back. You're watching Beat Diabetes, Myths versus Facts, and we're talking to doctors and getting all, the information that we need. Let's go across now to Dr. Rajeev Bagarhatta. And Doctor, blood pressure tends to rise with age, and there's a belief that it's okay to have higher blood pressure when you're older. Is this correct?
It's true that the blood pressure tends to rise with age, and because of the stiffness of the arteries, that is the vessel walls, the systolic blood pressure tends to rise. On the other hand, the diastolic pressure doesn't rise so much. So keeping these things in mind, these facts in mind, the guidelines suggest that the target blood pressure which has to be achieved by a particular group of patients, especially the elderly group of patients, is slightly higher as compared to younger age group. Meaning thereby that for those patients or those subjects more than 65 years of age, the target blood pressure which is to be achieved is aimed at 140/90 as compared to those targets which are meant for lower age groups, that is below 65, which is 130/80. So that's one fact. Also there's a common notion that a slightly high blood pressure is better for patients who are of a older age group. And how does it help? There are 2 points regarding this. The first one is, it is an indicator of a good heart. Those patients who have good heart, their heart is able to pump up enough blood into the arterial tree and maintain a reasonably good blood pressure. So that's an indicator, that's an indirect indicator that the heart is working fine. Secondly, it's also been rationalized, that those patients who have got slightly higher blood pressure, especially in very old age group, meaning thereby more than 80 years or 70 years, 75 to 80 years, it also means that they are able to perfuse their brains better, and that prevents dementia. The bottom line is that we have to customize our high blood pressure treatment strategies according to a particular patient age group. For example, if a patient has got diabetes, if a patient is a smoker, in that we can't afford to have a higher targeted blood pressure.
All right. Now, Dr. Kamble, it has been noticed that people tend to consume more tea and coffee and consequently more sugar when they're working from home. So will this now lead to challenges in monitoring and managing diabetes?
Yeah, surely. Because the previous thing, what we talked about, the previous question, I answered you that high glycemic index would have to be avoided. But staying at home, we are usually addicted to have tea or coffee in our working hours, where we try to keep ourselves awake and work according to our required thing. So to boost ourselves, we sometimes take tea or coffee. People who are diabetic, they should not use the sweetness like sugar cane products or sugar, jaggery, some sweetness which I don't prefer personally, and these things have to be kept away. You can take coffee or tea in a limited quantity for yourself, to boost yourself, to keep yourself awake as required, but maintaining the quantity of your cup which touches your lips, but keeping away the sweet taste from that tea or coffee. If you take more sugar, tea or coffee, automatically your plasma glucose levels will increase, wherein your medicines will increase, whether it is injectable medicine or whether it is oral medicine. The dose of the medicines or the duration of the medicines will increase. So preferably keep away the sweetness from your diet.
All right, Dr. Swami, now can controlling blood pressure, blood sugar and regular physical activity help patients reduce the risk of infectious diseases?
Yes, there is direct correlation between the physical activity and the blood sugar control and the chances of getting an infection or the course of an infection. It was a general observation during the COVID pandemic that diabetic people who had their blood sugar under control had less stormy course, less hospitalization, less stay in the hospital and less of the complications. Similarly, if a person gets admitted in the hospital with COVID infection or some other infection and the blood sugar control is not good, both the short-term blood sugar control and the long-term blood sugar control, then the chances of developing complications, chances of getting admitted in the ICU, use of artificial ventilation or other complication is more. So, in short, all the diabetic patients should control their blood sugar as far as possible. Again, the control of blood sugar depends upon person to person, and it is a customized approach to different type of patient. In young patient, the blood sugar control should be more stringent as compared to the elderly patient or who have got multiple problems. So, in short, the blood sugar control is directly proportionate with the outcome of the infection, and it improves the immunity. Similarly, undertaking 30 minutes per day of moderate intensity exercise at least 5 days a week is again associated with better immunity. So, a person who undertakes exercise regularly has got better immunity as compared to a person who does not undertake physical activity or exercise. Also, the activity throughout the day, like a person has got 30 minutes of aerobic exercise during the morning time, but if he sits throughout the day because of his job, then it is not good, and he or she should break the sitting. Sitting is also called the new smoking. So they should break the sitting every 30 minutes to 1 hour. So the total amount of the movement, physical movement should be more. And again, if this is more, if this is adequate, then the immunity is improved.
All right, so keep in mind in office to just keep getting up and moving around. Now, Dr. Bagarhatta, some articles mention that one can lower your risk of heart disease with vitamins and supplements. Is this possible?
The recommendation goes like this, that though one is encouraged to have healthy foods in the form of fruits, fresh vegetables, salads, nuts, fish, but at the same time, taking the ingredients of these nutritious foods in the form of supplements doesn't serve much purpose as far as decreasing the risk of heart disease is concerned. There have been many observational studies to effect this conclusion, but there is no as such clear-cut data to suggest that supplementation in the form of capsules or other formulations are going to reduce the risk of heart disease. There have been suggestions that supplement in the form of folic acid derivatives, chromium, vitamin E, vitamin D, coenzyme Q, all these additions in the form of supplements are going to reduce the risk. But there is a strict no as far as intake of these supplements is concerned. On the other hand, it has been also documented that supplement with vitamin E may increase the risk of hemorrhagic strokes or heart failure. So as of now, what the recommendation says is that though one should encourage to have nutritious diet, but any form of supplement by the intake of vitamin D or fish oils or chromium or silicates, that is going to decrease the heart disease? No, it's not going to so.
All right, so an important point there when it comes to these vitamins and supplements. Well, thank you so much, doctors, for joining us on the program today. You're watching Beat Diabetes, Myths versus Facts. So thanks for watching. Goodbye.